Hi, I'm Dr. Beyer. I'm glad you got my DVD. You got my DVD either because you visited my website and requested it, or you're the friend or a family member of an existing patient of mine, and that patient took a DVD out of my office and gave it to you. Either way, I'm glad you got it. We're going to cover a ton of information here about diabetes and pre-diabetic conditions. We're going to take about 30-35 minutes. You may want to hit the pause button, get a sheet of paper, pen or a pencil, take some notes down, because like I said, we're going to cover a ton of information that most people don't know. And if people are just if they're motivated and willing to do what needs to be done, okay, to get their blood glucose under control, they can a lot of times eliminate medications or drastically reduce them and just significantly improve their health and their quality of living. So we're going to talk about how I do that with functional medicine. Just a little bit about myself. Practicing chiropractor since 1994, and my practice at this point and for a number of years really has been kind of half and half. Half of it is kind of traditional musculoskeletal conditions that you would treating conditions you would typically associate with a chiropractor, like back and neck pain and things like that. But the other half of my practice is focused in on chronic conditions like diabetes, pre-diabetic conditions, thyroid problems, irritable bowel syndrome, things like that. Conditions you wouldn't typically associate with a chiropractor. And I'm able to help people with those type of conditions by virtue of the training that I've had over the years in functional medicine and functional neurology. I have had a boatload of training in different aspects of functional medicine, including functional blood chemistry analysis, hundreds and hundreds of graduate hours in functional blood chemistry analysis, functional endocrinology, functional neurotransmitter assessing and balancing, really intensive specific courses on the natural treatment of thyroid conditions by some of the brightest minds in natural health care. And I also additionally have taken a lot of extra training and am currently enrolled in a specific program that leads towards having a diplomate in chiropractic neurology, which, in other words, leading towards becoming a chiropractic neurologist. I'm enrolled in the Carrick Institute of Graduate Studies that leads towards a diplomate status in neurology. And all of that comes into play with different chronic conditions, including diabetes and pre-diabetic conditions, as you'll see as we go through this. So just kind of a little bit about me, because otherwise, you're thinking, how does a chiropractor treat or help people manage their diabetes condition? And really, it has to do with this extra training I've had in functional medicine and functional neurology. A few statistics about diabetes. It's unfortunately a pretty prevalent condition. In 2007, they estimated that in the United States, 23.6 million people have diabetes, and yet 1/3 are undiagnosed. Diabetes is the #1 new cause for both blindness and kidney failure. 60 to 70% of people with diabetes have peripheral neuropathy and or some type of sexual dysfunction. So it really significantly impairs or encroaches upon people's quality of life. And like I said in the beginning, if people are motivated to do what needs to be done, they can dramatically improve their quality of life and get much better results by actually addressing the underlying issues with my functional medicine approach. Some early symptoms of diabetes are bad skin's not quite right, the legs kind of become itchy. The classic symptoms of diabetes are the polys: polyuria, polydipsia, polyphagia. Polyuria means you're urinating a lot. Polydipsia, you have a lot of thirst, and polyphagia, you tend to be more hungry. And there's reasons for that because of what's going on inside the body. The diagnosis for diabetes is to have a fasting blood glucose level at or greater than 126 milligrams per deciliter. That's what they're looking for to diagnose diabetes, not random blood glucose, but a fasting blood glucose of 126 or greater. Or if they see the glycosylated hemoglobin, the HA1C or HbA1c on some labs, if they see that 6.5 or greater, then that is enough to give a diagnosis of diabetes. And there's also what we call, which is probably even more prevalent, pre-diabetes, or there's a whole bunch of names pre-diabetes can go by. It's known as insulin resistance, or metabolic syndrome, or syndrome X. And that's when people are having their blood glucose higher than it should be. It should be below 99 on a blood test, a fasting blood glucose. So it's higher than 99. It's 100 or greater, but it's not 126 or greater yet. So it's kind of in that gray area. And one thing that's really unfortunate is that a lot of medical doctors will tell people, just kind of cut them loose, when they're in that pre-diabetes range, and they do that because there's nothing they can do for them. They don't. The only thing they really do treatment-wise is oral hypoglycemics like metformin or insulin therapy. And that's really unfortunate because it's like any other condition. The sooner you treat it and address it, the better results you're going to get, and people can avoid going on insulin, which you don't want to go on insulin. I mean, if you are, we can still do things, but once you start taking insulin, for most people, your life's never the same, unfortunately. So with diabetes or with pre-diabetes, in either case, insulin is just not working. Insulin's not doing its job. Insulin's job is to get glucose, from the bloodstream into the cells. That's its job in life. Insulin is a hormone. It comes from your pancreas, and its job is to take insulin and get it out of the bloodstream and get it into the cells, which is super important because glucose or blood sugar is the main energy source for all the cells of our body, for all the 100 trillion cells of your body. It's the main energy source. And even more significantly, glucose is the only energy source for the brain. In other words, all the other tissues of the body can get energy from glucose, which is the main energy source, or from proteins or from fats. They can absorb proteins and fats and get energy from it. But the brain cells are different. The neurons are different. They can't absorb proteins or fats and get energy from it. They have to get energy from glucose. And so think about that. What's happening with diabetes and pre-diabetes is the glucose is building up in the bloodstream because it's not getting into the cells. It just can't get in there. It's outside the cells in the bloodstream, and it's useless for energy outside the cells and in the bloodstream. Glucose in the bloodstream is kind of like you taking gasoline and pouring it on the ground outside your car or truck. It's not going to give energy to your car or truck poured on the ground outside. You got to get it in the gas tank. Well, insulin is what opens the lid and unscrews the cap to your gas tank. It's what opens the cells up and allows glucose to get in there. So, if insulin's not working right, and it's not working right with diabetes and with pre-diabetes, then the body suffers. It can't get energy, and particularly the nervous system. It particularly is sensitive to glucose not getting into cells because glucose is the only energy source for the neurons, for the nervous system. So that's insulin's job. That's what's happening with diabetes and pre-diabetes. But why is insulin not working? You have to ask that question. Why did your body get to the point where insulin can no longer open the gas lid and unscrew the gas cap and allow gas to get into the gas tank? That's kind of the analogy. Why did insulin get to the point where it can't allow the cells to get glucose into there? And what happens is that people chronically, and we're talking type 2 diabetes, we're not talking type 1 diabetes, which is a different scenario. It's an autoimmune condition, and it's insulin dependent. You have to have it. Your body's just not making insulin with type 1 diabetes. But with type 2 diabetes and with pre-diabetes or insulin resistance, that's not the situation. The body has for years produced insulin. Insulin has just become ineffective, and there's a few reasons for that. One of the reasons for that is because over a long period of time, chronically, there have been surges of insulin. There has been chronically elevated insulin levels, and certain things can cause that, like waiting too long between meals, and then you have a meal, you get a massive insulin rush. You eat, or another reason is you eat too many carbohydrates at a meal, too many carbohydrate-rich foods, and you get a massive insulin surge or rush. Eating too much sugar will cause a massive insulin or a surge or rush. And when that happens, the body eventually becomes resistant to the insulin, because any hormone in the body that's chronically elevated, what happens is the cells stop listening to it. Okay, so if for whatever reason insulin is elevated too often for too long a period of time, the cells stop listening to the insulin. That's what happens. Okay, it's kind of like the analogy I give in the workshops that I do is, imagine that you work for me. Okay, you're an employee of mine, and this would never happen in real life because I'm not this kind of guy, but imagine every day you come into work for me, and I'm yelling and I'm screaming at you, okay? And you absolutely cannot quit because you need the job. You have to work for me. There's no other jobs. You need this job. And so every day you come in, I'm yelling and screaming. And so because you can't quit, what are you going to do eventually? What you're going to do is you're going to stop listening to me, okay? You can't quit. You have to work. And I'm yelling and screaming every day. Eventually, you're just going to stop listening. You're going to tune me out. And that's kind of what's happening with insulin, okay, and the cells of the body. The cells of the body just get sick of so much insulin, okay, that's me yelling and screaming, and so they stop listening to the insulin. The insulin doesn't work very well. It starts becoming less and less effective, and then what happens is the glucose can't get in the cells because that's insulin's job. And that glucose builds up in the cell, in the bloodstream rather, and like I said, you have fatigue and lack of energy because that's your body's main energy source. The body has to do something with that extra glucose, okay, and so it turns it into fats, okay, and that's why people's triglycerides and cholesterol levels get elevated because the body's got to do something with that extra glucose, okay. Even though there's a lot of glucose in the bloodstream, it's not in the cells, and so the body perceives that, and so the body secretes a lot of extra of another hormone called cortisol, because cortisol raises the blood sugar. I mean, the problem isn't that the blood sugar is too low, but the body thinks that it's too low because the glucose is not getting into the cells, so it secretes a bunch of cortisol. Cortisol raises the glucose even more, and people get in this vicious cycle. They get in this vicious metabolic cycle, where the blood glucose just keeps going up and the body just becomes progressively more and more resistant to the insulin. The insulin is screaming at the cells stop listening, the insulin doesn't work. Vicious cycle. It can be broken out of, and we'll talk about how to do that, but that's the vicious cycle that people are in. A couple other reasons why insulin stops working very well, we mentioned surges of insulin. Another couple reasons why insulin stops working is because of lack of exercise. Exercise tends to kind of flush out the old insulin out of the system. And so exercise is a good thing in that regard. High stress also will cause the body for the insulin to stop working, because high stress causes a secretion of that hormone cortisol, which again raises the glucose, and when the glucose gets raised, the insulin gets raised. So these are all reasons why you can get elevated insulin levels, which leads to the insulin not being very effective anymore. So with that as a background, think about the medical solution for this problem. Okay, the body's not listening to insulin. All right, the body cells have become resistant to insulin, and so what's the medical solution? Give more insulin. Okay, either through